The House of Representatives has to hold itself accountable to fiscal responsibility. We cannot continue to spend money that we do not have, entrenching our country into more debt that future generations will be unable to pay back. We do not need another redundant public health office to advance politicized work of the federal government's public health operations. And furthermore, as a business owner, I know the value of industry driving policy and not policy driving industry.
Think about what happened during the pandemic with all of the laboratories around the country. I'll speak about Connecticut. Nearly shut down, couldn't do its work because it doesn't have the equipment, the modernization, the ability to collect data that makes it incredibly important for us to deal with a pandemic or any other disease. We all want to know the scope of a foodborne or an infectious disease outbreak in our community. I suspect my colleague wants that information for himself, his family, and for his constituents. We all do. But that does not happen without the data first identifying the cases.
This amendment cuts back spending for the Office of Public Health Scientific Services by more than $158 million to return us back to our fiscal year 19 funding levels. This reins back the irresponsible balloon spending that we've seen during the COVID-19 pandemic. Our public health offices, particularly during the COVID-19, have proven they do not effectively follow scientific method. In fact, I would argue that this body only follows political science, not medical science. While some of these offices certainly played roles in helping to research the effects of COVID, others, like the Office of Public Health Scientific Services, were ineffective and do not serve their purpose. These cuts encourage increased collaboration with the private sector to leverage external resources and expertise to support the public health initiatives. With that, I reserve.
This would reduce the CDC's Public Health Scientific Services account by $158 million. Bringing this account to the 2019 level, what would it eliminate? Think about it. Significant advancements in public health, negatively impacting the National Center for Health Statistics, for laboratory science, and for public health data modernization efforts. I have personal propriety on data modernization. I championed and I established the establishment of a public health data modernization initiative in fiscal year 2020, just prior to the pandemic, I might add. A massive undertaking is moving public health away from the fax machine and into the 21st century. This provides, this modernization initiative, I might add, provides funding directly to 64 jurisdictions, states, territories, large cities, tribes. Eliminating this funding impacts the entire country. We look to, and I suspect that my colleague on the other side of the aisle has the same view, as that the local jurisdictions, the public health, needs to have the capacity to do its job. This funding is critical to improving jurisdictions' public health decision-making capabilities. And that is for, some have very high-rated and forward-thinking and decision-making capabilities, and they have what they need. But we have a lot of communities with minimal capacity, such as those, this is really pretty extraordinary. We have people entering records by hand. They're writing their records out by hand, or using software not designed for tracking outbreak data to be able to publish provisional national death data on a weekly basis. Some places have no capacity to do this, and they're not reporting the data, so that we have no idea what is happening. Our public health data systems, laboratory resources, and the National Center for Health Statistics are already so far behind where they need them to be. And this amendment would only make matters worse. We should have learned a very, very big lesson from the pandemic, where our public health infrastructure, in many instances, crashed because of the lack of technology, the lack of data collection, of lack of modernizing their ability to collect that data. So I urge my colleagues to oppose this amendment, and I reserve the balance of my time.